Ringworm is now being sexually transmitted. Here's what you need to know. 2 rare ringworm infections affecting the genital area are surfacing in the United States, potentially spreading through sexual contact and showing resistance to standard antifungal medications. One such case documented in JAMA Dermatology involved a man from New York City infected by Trichophyton meningrophytes type 7, TMVI. This infection, presenting extensively in the pubic and genital regions, followed his travels to England, Greece, and California, where he had multiple male sexual partners. Previous research in France described 13 men with TMVI, 12 of whom had sex with men. The infections, believed to spread through sexual contact, showed lesions in the genital area. Some infections were acquired locally, while others were linked to travel to Southeast Asia and contact with local sex workers. Factors such as prolonged skin-to-skin contact and shared towels or linens could contribute to the spread, making it difficult to attribute solely to sexual activity, according to Cadence Aquaviva from the New York Department of Health. Another study examined 11 patients with a related strain, Trichophyton indotinei, which also spreads primarily through close skin contact and resists standard antifungal treatments. These infections, presenting as widespread, inflamed, and itchy rashes, can be misdiagnosed as eczema or psoriasis, noted Avram Kaplan, MD, from NYU Grossman School of Medicine. The goal of publishing these reports is to alert clinicians to consider these fungi when diagnosing persistent lesions in the genital area. Trichophyton indotinei, mainly identified in India and Bangladesh, is now spreading globally. Initial cases in the U.S. were reported in New York last year, but earlier cases might have gone undetected. Infections often affect the face, body, and groin, with immunocompromised individuals being most at risk. However, many patients are immunocompetent but show significant ringworm infections. Standard antifungal treatment, terbinafine, has been effective for TMVI, though patients required prolonged treatment. However, T. indotinei resists terbinafine, necessitating alternative antifungal medications that have significant side effects. This resistance highlights the need for advanced testing to identify the specific fungal strain and appropriate treatment, emphasized Mahmoud Ghanem, Ph.D., from Case Western Reserve University. Diagnosing trichophyton infections accurately involves lab analysis of infection samples to determine effective medications. With antifungal resistance on the rise, testing ensures the correct treatment, as some fungi are pan-resistant to all available antifungals. The CDC is conducting a survey to gauge the prevalence of trichophyton infections in the U.S., but there is no current evidence of widespread infections. If you notice widespread rashes resembling ringworm, particularly around the genital area, seek medical attention promptly. Early diagnosis and appropriate treatment are crucial to managing these infections effectively.